understand everything that you're taking, okay? And so I'm going to go ahead and for those of you, again, I'm Alice Benjamin, family nurse practitioner, background cardiology, critical care, emergency medicine. My mantra is I like to talk to people before they become my patients, which is why I've been a long-time ambassador with AARP, just kind of, talking with the people about things that are important for your health and wellness and longevity, because at the end of the day, many of us, that's what we want. And so while I'm not your direct provider, this is just for informational purposes only, but hopefully there is something you can glean from here that will help empower you in your health journey and help you to feel empowered to ask questions with your provider. So that way, when you're talking to your doctor or nurse practitioner, you can feel like, I know a little something, let me make sure I ask, because sometimes we don't know what we don't know. And so that's the whole purpose of this conversation today, is to really empower you with some tools, some tips, some nuggets, so you can have a more informed conversation with your doctor, with your pharmacist. All right. Okay, so why does this matter? We're going to talk about medication safety. And we've all at some point or rather have taken some medication, whether it's something short term, maybe a short term of antibiotics for a particular reason. Maybe you had a headache and you took some Tylenol or something Motrin over the counter, or maybe you have a medical condition that warrants taking daily medication and sometimes frequently throughout the day. But either way, medication safety is very important. And even I'll say a little more important also as we age, because as we age, uh, more of us as we age, we're more subject to having these chronic conditions, and we might need to take more than one medication at one time. And so we can live a happy and healthy life and successfully manage those things. But it's going to be really, really important that we look at our medications and not just take it so lightly, even if it's just something you bought over the counter, because all of these things collectively can influence each other. It's almost like a chemistry experiment, if you will, if we're not careful with what we're taking and what, make sure that we're not at, and we have to make sure we're asking the right questions. That way we can continue safety because there's a lot of different things that can happen. They interact, they can counter each other, you can have side effects, but all of these can pose a risk to our health, which is why it's important that we discuss medication safety. All right, so part of today's goals. Now, there's several things to talk about, but in the short time that we have together, I'm hoping that you'll walk away from today's conversation with something from at least one of these bullet points. How to avoid common mistakes. So we're going to talk about some of the most frequent medication errors that can happen. We don't mean to make them, but sometimes we can make them. And so how do we sidestep these before they can cause any potential harm? We'll talk about recognizing some warning signs. So, whenever you start a new medication, whether it's prescription or just something you took over the counter, recognizing what symptoms you need to be on alert for and what would warrant you to need to call your doctor or maybe even go to the emergency room if you start having some symptoms. Also, when you talk to your doctor or your nurse practitioner, how can we better prepare you for those visits so you're getting a good assessment and reevaluation of your medications? So every time you leave an appointment, you want some clarity around your medications. What is it? Why am I taking it? What are the side effects? And when do I need to see help if these particular symptoms happen? So those are some things you want to know. Even some things like, well, what do I do if I have a missed dose? Which is a very common question that people don't ask until they're in that situation. And then also, again, how to prepare for your appointments so it doesn't feel too laborious. Because I want to provide you these tips, but I want to make it easy for you. Because our health overall can be overwhelming, especially with whatever we're being seen for. And so adding this safety tip to it, we want to help you prepare. So we'll leave you with some questions and kind of a checklist, if you will, of how you should prepare for your appointments. All right. Okay, so why many older adults take multiple medications? Well, as we age, obviously, we've lived life a little bit longer, and so it's not uncommon that we might need to take more than one medication to treat a particular medical condition, whether it's for our blood pressure, cholesterol, diabetes, arthritis, acid reflux, sleep, whatever the case may be. There's multiple things. And then you add in the vitamins that probably many people are taking over the counter because they've heard that, oh, This particular vitamin is good for my bones. This particular vitamin is good for gut health and all of those things, these supplements. So you can see how the list can quickly add up. And sometimes people don't look at, they think that the medications that they only need to focus on are the ones that are prescriptive. But in reality, you need to think of all of those medications and those supplements as things that we're going to put in this kind of group of medications here. And so it's common for many people to be taking several medications, but it's also very important that we review them regularly. Because in general, your medication list, and I don't know, you guys can let me know in the chat box if you've done this or not. How many of you all review your medications at least annually with your provider? Like you literally purposely like, okay, let's review my medications. Do I still need to take this? How are we doing with this? And kind of just assessing and evaluating what's on the list, but not just your prescription ones, but also self-admitting the ones that you take over the counter. Like, okay, I take Aleve 4 times out of the week, or I'm taking vitamin D3 also, or I'm taking all of these things. So how many people have done that? Did we get anything in the chat box? I can't see. What are we doing? How many people? I can't see the chat box.
No one
Okay.
has chimed in just yet,
Okay.
Nurse
Well,
Alice.
my question was how many people have done it? So how many people do that regular? And if you don't, that's okay. That's okay. This is what this safe space, this is what this
Yes.
conversation is for. Okay,
Someone
good.
did check in and say Howard said doctors discuss it with him at appointments.
Okay, good.
And yep, yeah, they're starting to come in. Kathleen, yes, the doctor keeps up with our meds every visit. And somebody else, Haresh, says they've done it as well.
Okay, very good. And I'm so glad that your doctors are being proactive about that and
Mhm.
looking at it. Now, while you're having that conversation, though, make sure if there's something that's not on that list that you tell them, like, oh, I've started to take magnesium glycinate for sleep at night. Because it's a supplement. So some people don't think it's as serious or necessary. It's very benign, which many of them are benign. But in some cases, those medications, those supplements, can interact with some of your medications. So that's why it's important to bring it up. And we're going to get into some examples here shortly. But we can see as the old, as we age, myself included, it's important to evaluate all of our medications because some we absolutely need to manage our chronic medical conditions, and then some we're doing to add to our health, but we want to make sure that we have the conversation so that we're doing everything safely and not countering any of those efforts. And so there's a term that we use called polypharmacy. Now, the criteria for this is when someone is taking multiple medications, often 5 or more, to manage their health conditions. Now, if you take 5 or more, is that a bad thing? No, not necessarily. And in fact, according to the CDC, about 1/3 of U.S. adults between 60 and 75 regularly take, it says fire, it's supposed to be 5 or more medications. But one of the things also as a provider, when I see that someone is on 5 or more medications, I lean in a little bit more because I want to make sure, I want to assess if there's any type of interactions that could be happening. Could one medication be weakening the effect of another, and those type of things. So it's an opportunity to evaluate all of the medications to make sure that we're not necessarily doubling up because we know some medications can do more than one thing, and so perhaps you don't need need another particular medication if you have one that's a little bit of a twofer. But I mean, it gets a little complicated, but that's why it's so important to evaluate your medications. I'm not, please do not walk away here like, oh, I don't need to take my medication. This is not what this is. What I'm saying is, if you're, especially even more so when you're on multiple medications, that it's important to evaluate. Some you may be able to wean down. Some you may be able to, won't need to take, but that's a discussion for you and your doctor because the goal is that you're taking the right medications and it's safely managed. And so I've kind of alluded to this already, but why is taking multiple medications? How can that be risky? Now, when we need them, we need them. That's important. Don't just stop taking your medications. That is not the takeaway here. But the reason why we want to talk about this is because when there are multiple medications involved, it can increase the risk for certain conditions. So one medication might cause dizziness, another one might cause sleepiness, and together those can increase your risk for falls. That we want to avoid. Sometimes two medications do similar things and create a duplication. And sometimes doses get missed because the schedules can get too complicated. So there are quite a few things that we want to look at here. And another risk is that multiple medications, they can sometimes work against each other. So one medication may raise your blood pressure while you're on blood pressure medications to bring down your blood pressure, right? So we got to make sure that they're not working against each other. And this is all for safety. And we want the treatment to be effective. We don't want there to be any confusion. So it's really important that you get your medications assessed and at least annually. But I'll also say this, if you have any dose adjustments, or maybe you start a new medication that gets added to the mix, feel free to use that as an additional time to reevaluate. So you don't only have to do it once at your annual health and wellness visit. If something's thrown in the mix, something's changed, it's another opportunity like, okay, something's changed. Let's look at everything all over again just to make sure that everything here is safe. Okay, and so, well, Nurse Alice, what am I paying attention to? Because I'm not the doctor. I don't know, right? Well, it's very important. You know yourself best. And the doctor or the nurse practitioner, they'll look at your labs, they'll look at your blood pressure. There's some numbers that they can look at, but we're not with you all the time. We don't know how you feel. There are times where there might be some changes. If we've changed a medication based on some lab values, but then you go home and you feel crappy or horrible about it, well, that's probably not the best thing to do all the time, right? We need to know that information. So whenever you start or stop new medications, it's very important to know, take notice of the timing. So, did you have symptoms that maybe started as soon as you changed the dose? Like, for example, your blood pressure maybe wasn't being managed so as well, want to get a tighter control, so the doctor increases the dose of your blood pressure medications. But if you all of a sudden are really dizzy, and just, can't get your bearings about yourself or feel like you're going to fall or pass out, we need to know those things. That's extremely important. Now, there may be like an adjustment period where it's like, okay, it's new. But let the doctor talk to you about that, right? Say, okay, we're going to adjust your medications. With this, make sure you don't take your medications and just go out there and drive. Let's see how you feel. If you feel like you're a little lightheaded or a little more than usual, let me know. We'll reevaluate to see if that change was too much or what else we can do. But you want to pay attention to changes. And don't assume that it's normal, right? So many times symptoms can coincide with a new prescription. So you might have a busy family weekend, but then you also had a change in medication. So you might say, "Oh, I was busy with the family. It's probably I was just doing too much." Really, maybe, but it could be also your medications. We don't know, so don't assume that these new symptoms are just attributed to something else, especially if you had a change or new medication. And when these things happen, jot them down, take notes, because oftentimes by the time you get to your appointment, you kind of forget, or it gets a little hazy, or you can't recall exactly how many times it's happened. So keep a brief log. Whenever you start a new medication, change your medications, keep a log, at least for like a week, 2 weeks or so, to see if there's been any changes in your symptoms. And that way you have more kind of concrete information. So when you do talk to your provider, you can literally say, okay, you know what? Every day when I took my blood pressure medication, I felt dizzy for about 30 minutes and I couldn't drive, or I felt, had photosensitivity where the sun was just too bright and I couldn't step outside. We need to know these things to make sure that the medication we're giving, while it's there to help you, isn't causing you harm, or perhaps it might be interacting with something, but we won't know unless you tell us. So please pay attention to those changes and document them. Now, these are some of those side effects that commonly get ignored. So, in the chat box, if we can just have an honest moment, how many of y'all have experienced some of these symptoms, maybe had some changes or started a new medication or something, and just kind of just brush these type of uh, common side effects off? Because they're very general, right? They can be. Um, I mean, things from like fatigue, unusual tiredness, right? Who's not tired in today's society? I'm telling you, a lot going on, right? So, and then you say, "Oh, well, I didn't get enough sleep," or you know what, I was going all day, and that could be some of the case. But what if it's related to your medication? We don't know, or maybe your medication could be making you more exhausted than usual. Um, Also, constipation, very common but overlooked. Sometimes we're just like, oh, I just didn't drink enough water. Well, maybe you started, maybe you were drinking enough water, but this added medication just kind of you know, it can cause constipation. So maybe this is a time where you need to drink more water than usual. So those are some things that you need to consider. Um, oh, also, if I may, I just want to make sure I was looking at my notes here to make sure I didn't miss anything. When we're looking at these common side effects, it's important to note them not because there might be some lifestyle things like I'm mentioning, like the activities and chopping it off to certain things. But sometimes when you uh, add medications, if you're taking more than multiple medications, these can actually be an interaction. Um, if I like, for example, let me go back to fatigue for a second. So you might, let's see, fatigue can often occur when you take some allergy medications. Like sometimes we'll take Benadryl if we're feeling a little bit itchy, or maybe if we feel like we want, some people will use it as a sleep aid. It's purchased over the counter, but that can interact with your blood pressure medications like metoprolol or even some sleep aids and exacerbate the fatigue. So that's where that polypharmacy situation comes in. So is it my is it my activities? Is it the medications that I'm taking? We gotta figure that out. There's a lot more things, and even things like dry mouth. Um, this can affect your eating, speaking, and dental health over time. So some people take medications that are called diuretics, kind of like the water pill, if what you'll call them, like Lasix, right? Well, if you take Lasix and then you take Benadryl, you can have even more of a dry cotton type of mouth, right? So in those situations, you just got to understand the importance that these medications can actually interact with each other like that. And then even with brain fog, like a mental cloudiness, sometimes people are on certain chronic pain medications or anxiety medications, and then you mix that with some over-the-counter and I'm not picking on Benadryl, it's just the example that I'll share. But all of these things can collectively exacerbate or worsen side effects. So don't just write them off as to, oh, it was just the day. It actually could be an interaction of your medications. And some of them are so mild that we don't even realize that it's a reaction or interaction of our medications. So don't blame it on aging, like, oh, I'm just getting old. Listen, I've done that too. And so whenever there's new symptoms, they deserve attention, especially dizziness, confusion, appetite loss, sleep changes. These should never be dismissed without having a conversation with your provider. Some of the things we're going to ask is, when did these symptoms start? So that's why when you add something into the mix, even if it's over the counter, because I imagine, or maybe it's just me, if you look into everyone, I think has like a quote unquote medicine cabinet at their house. Does everyone have that? I don't know. I don't know how we came up with that, but it's like that's the cabinet we go to when that's where the Tylenol, that's where the multivitamins, that's where everything is. And so we keep things for like emergency situations, like, okay, I have something for diarrhea, I have something for headache, I have something for this and that, just in case. It's almost like my mini pharmacy in my house. So it can make it easy for us to grab these things and throw them in the mix. And sometimes we don't even take them frequently enough to even know that, oh, that could have been the case. Because maybe you don't take Benadryl at all, but this particular day you were really itchy. You think there was maybe some poison ivy or something going on. You're like, I'm going to take some Benadryl because my skin's really itchy. And then that's the day or the couple of days after you're feeling extra dry and things like that. That's why it's important to keep track of that because maybe you don't take Benadryl enough to know that that was an interaction. So you kind of just write it off as to, oh, just must have been a day, a moment there. Okay. So again, oh, there we go. Maybe that's why I was picking on Benadryl because it was in my picture. But over-the-counter medications, these definitely affect your health too. When we go to our appointments, our doctor's appointments, and they'll check in. They'll say, "So any changes to your medications?" Um, Ideally, they should. If they don't, say, I'd like to go over my list and then have them confirm. They'll say, "Are you still taking this? Are you still taking this?" You want to confirm though, you want to go through that list at every opportunity that they're offering you to make sure that they still have the right medication, the right dose. Because sometimes you can say, oh no, I stopped, the kidney doctor had me stop taking that. And so even having multiple doctors, they're not always on the same page. Their health records don't always talk to each other. Although things have gotten better with electronic health record, not everyone's electronic health record talks, right? Especially if they're out of system. So it's really important that you go over your medications, but so in this, include the over-the-counter medications that you've taken. So, um, if you're taking, like, let's see what's on here. I don't want to pick on Benadryl anymore. If you're taking Theraflu, right? Let them know you're taking Theraflu. As benign as it may seem, please let them know that you're taking that because there are certain ingredients in those medications that can also interact with your prescriptive medications. There's definitely a real effect because these over-the-counter medications can definitely affect your blood pressure, your kidney function, and like to that point, like let's say you're someone and you're going to the kidney doctor, right? You're just kind of keeping a close eye on your kidneys. There's maybe a diminished function with your kidneys, and we're trying to do everything to protect our kidneys. So the doctor is very mindful that all your medications are kidney safe. But then if you go start taking stuff over the counter, those might actually not be as healthy for your kidneys, or there might, so making sure that you talk to your doctor about what's going on because we don't want to undo any of the progress we're making towards staying healthy. Um, Here's some common over-the-counter medication risks to know about. Um, a lot of people again forget to mention these store-bought medications, but there are definitely some side effects to them. Now, they're over the counter, so one can say, "Well, Alice, if they were that serious or if they were that bad, why would they even be sold over the counter?" Well, the things that can get sold over the counter are generally medications that have very clear indications and that in which a layperson would understand its indications. So, like Tylenol, Tylenol, ibuprofen, for the most part, fairly benign, but it's very written clear on the label to not take a certain amount over a certain period of time. If so, follow up with your doctor. But we do know that if someone's chronically taking Tylenol around the clock every day, that can have a toll on your liver over time. So those are some things your kidney over time. So those are some things we want to talk about. It also can cause you to have stomach ulcers and those type of things. So something that's benign, it's like, well, this is for my headache. Can't be that bad. It's over the counter. Anyone could buy it. But long term, it could have some risks. So that's why it's also important to mention this because, and okay, I'll leave it there. And then like sleeping aids. Over-the-counter sleeping products, those can contain antihistamine and they can cause you to be more groggy, increase your fall risk, and especially if, and the labeling isn't always great about telling you when you should take something, right? So let's say you're having problems sleeping. I don't want to talk to the doctor because I don't want prescription medications because those are presumed to be too strong. But instead, I'm going to take an over-the-counter sleep aid. You got to be careful with that. You got to be careful because they're still effective with helping you to fall asleep. But sometimes if you take these too late, then you'll wake up more groggy. The medication is going to be in your system. So actually, for over-the-counter medications, if you're going to take a sleep aid, and let's say you want to be asleep by 9, you probably should take that by 7:30. You got to take it before. So it's something you plan ahead. Because if you go to bed, it's 9 o'clock, it's 10 o'clock, 11 o'clock, you're still tossing and turning in bed, and you're like, you know what, I'm going to take a sleep aid. And it's 11 p.m. at night. That sleep aid is going to stick with you till way in the morning. So you will be more groggy in the morning. And so these are things you got to consider. They're over the counter, but they can still have impact. And then just think about that. You're groggy in the morning, a little bit woozy. And then you want to if you take your blood pressure on medication on top of that, which can bring your blood pressure down, the room will be spinning. So we got to talk about these things. Um, there are certain cold medications. Now, when we're cold and when we have a cold, we don't like the symptoms. We don't like them at all. We want them to go away, right? Um, and if there's like, let's say you have a viral cold, the traditional viral cold, well, it doesn't get treated with antibiotics. It generally has to run its course, but we take over the counters because we want to minimize those symptoms, and that's fine. There are products that can do that, but if you're someone with particular medical conditions, there are certain over-the-counter cold medications that are more preferred. And so I'm not endorsing any type of medications, but in this example, I'll use this like, let's say you have a cold and you have blood pressure, high blood pressure, you take blood pressure medications. There are some cold medications that are designed for people with high blood pressure. One of them that I commonly see is quercetin. it's a whole the whole line is built for people who have high blood pressure and they have cold symptoms. So their ingredients are done so they are less interactive with them, right? So talk to your doctor about, you know what, I have a cold, what's the best one for me? And then that way the doctor knows all your medical conditions, knows what you're taking, and then can help guide you to those over-the-counter medications. And same with heartburn and allergy products. Um, Long-term use of antacids over the counter. Um, and that's that kind of gastroesophageal reflux disease, or what we call GERD or acid reflux. That's a pain in the butt. It's annoying. It's bothersome. People want relief from that. Absolutely. Are there prescription medications for that? Yes. And there's some you can buy over the counter. Some people commonly will take like Prilosec and those type of things, or some type of antacid, like, oh, I'm just going to take some Tums. And that's fine. But if you're taking Tums every day because your acid reflux is happening every day, you need to talk to your doctor about that, because these medications that are over the counter are not designed to be taken every day like a Tums. Um, that's something you got to talk about to your doctor, because that can actually influence how other medications are absorbed and how your nutrients are absorbed. It can actually decrease the effectiveness of some of your medications. So again, something we want to talk about. And
Hey,
supplements,
nurse.
yes.
Oh, Nurse Alice, I'm sorry. I just wanted to call out. There was a question. I think you just answered it. It said, "How long do you consider long term for over-the-counter meds?" And they were talking about specifically for pain relief. But I think you just said if it gets to a point where you're taking something every day,
Yes.
then there's an issue with that. You need to talk to your doctor about it. But I did want to call that out because that question was in the chat.
Well, that's a good question. So I will say this, because the medications, and I actually had some examples here that I was going to kind of go over. I got some props with me today. But I didn't have I didn't put a Tylenol here with me. But like, let's say you're taking something as pain medication. Usually it will say like, do not exceed X amount of dose in 24 hours. Okay, if you're having to take that particular pain medication for relief around with the around the clock for 20 and you're having to do so for anywhere from 3 to 5 days, sounds like it's something that's still worth at least messaging your doctor, calling your doctor about, saying, is this okay? I'm on all these medications, it's okay. So it doesn't always warrant a visit. Sometimes you can just send the inbox message, but let the doctor leave a message for the doctor to call you back so they're aware of the situation. Now if it's something like, I fell and my hurt my leg and I'm taking Tylenol, extra strength Tylenol, and it's still not getting better. Well, that probably you need to come in. You might have broken something. So that's also why we need to evaluate. So we need to make sure if the treatment matches the illness or the concern or complaint. Because if you're having to take that long, I might think there's something more serious. First, something more serious going on with you, and then two, if you're taking this I don't know, leave all the time around the clock, then I gotta I gotta balance some things like of your medical condition, your medications, to see if that is would be okay, or if there's probably a preferred or alternative treatment that's better given your medical history. Supplements matter too. So we got lots of vitamins. Listen, we all are walking down the health aisle. We're like, oh, I need vitamin this, vitamin that, vitamins, vitamins, vitamins. Vitamins are good, right? And minerals. More preferred if we can take them in through our diet, the natural way. But sometimes we do need to supplement. So let's see, what do I have here? So vitamins like vitamin E and vitamin K, those can interact for people who are on blood thinners. So if you're like on Coumadin or Plavix or something like that, yes, we want you to have all your vitamins and minerals, but check with your doctor um, to make sure that they're not countering or sometimes additive effects. Because um, sometimes you can take you can take a medication and then you take something over the counter. It can actually even make the medication more potent. That can happen too. Things like herbs like St. John's wort, ginkgo, and ginseng are also known to affect certain medications, how they work in your body. So everyone, natural, like what's it, complementary alternative therapy. Everyone wants natural type of things. And listen, we want to be all as much natural as possible, but we have to make sure that these medications aren't worsening anything for you. Um, let's see, CBD. That's gotten a lot of attention lately. And let me say this, there's a place and a space for all of these. It's just we want to make sure that it's properly placed in your particular plan of care. And so that's why you have to have the conversation with your doctor. But CBD can interact with blood thinners and other medications too. So we want to make sure that that doesn't happen because while CBD definitely has its place in like alleviating headaches, pain, helping people to relax and fall asleep. All of that's important, but then, it can do other things. It can actually either increase side effects or alter your medication levels. Let's see, gummies and powders, even protein powders and wellness gummies. Those can affect your blood sugar, especially gummies. A lot of the multivitamins that are able to transform into gummies have a little more sugar. So if you're someone who is maybe diabetic and you're working on trying to control your blood pressure, blood sugar, maybe not having the gummy version of your multivitamin may be helpful. Um, and so those are some things that you'd want to consider. So the key is that the supplements still count, but they don't counter our wellness and health goals. Now, some hidden interactions. This is where we gotta get careful. The road gets windy. Um, Sometimes there are some hidden interactions, so like bleeding risk. Certain supplements and over-the-counter drugs can actually amplify or increase some of that blood thinning effect, like I mentioned earlier. Sedation. Now, I didn't say drowsy or sleeping is sedation, meaning you're out. Like this is really making you a lot more sleepier. Maybe you're less attentive. It's hard for you to focus. Those are some things that can happen when you mix some of the herbals and over the counters with some of your prescription medications. So you got to be careful because this is what will increase your risk for falls. Blood pressure changes. Like I said, some of those over the counters and herbal products can either raise or lower your blood pressure. So, I mean, and there's so many. So this is why it's kind of, I've not named so many here, but if you're on blood pressure medications, we're trying to bring your blood pressure down. We don't want to take something that's going to just spike it, bring it back up. Um, that's kind of why that Quercitian brand kind of took off. I think the founder had blood pressure issues, something to that effect and then also can sometimes lower. And then, yes, we want low blood pressure, but sometimes we don't want it too low, right? Because that can also cause dizziness and things. And then your liver is, well, it's your liver and your kidneys. Medications generally kind of pass through with all the metabolism that happens there. The liver is doing like the first pass of breaking it down. The kidneys responsible for filtering stuff in and out. And so these can cause strain on your liver. So it's very important to talk about full disclosure about your medications because we don't want to cause, while we're trying to manage the blood pressure, we don't want to cause any undue stress to your other organs as well. So, just curious for the chat here, people let me know how many people only use one pharmacy? Or maybe like, oh, I pick up this medication from here, I get this medication from here. Just kind of curious. think I think for the most part, people try to go to the same pharmacist, but sometimes out of convenience, they just might end up somewhere else. Oh, let's close that.
Yeah. So it looks like a couple of people said just one. One person said more than one.
Okay. So why one pharmacy helps? So when all of your medications are at one place and a new order comes in, the pharmacist sees your profile, the pharmacist sees your profile. Now, and also let me shout out to our pharmacists. So I've said a lot about your physicians and your providers. Uh, they are experts in diagnosis and broad treatment. The pharmacist is the expert in medication. So you may not know this, but your doctor is going to call the pharmacist and say, hey, does such and such interact? I need to know because it's just so much for them to know. And so the pharmacist is really the expert and specialist to know what interacts, even over the counter. So I've said talk to your doctor, but also when you go, when you go to the pharmacy and they says, would you like a consult with the pharmacist? Say yes, because that is your time. That is your free visit to say, can you tell me if this interacts with these things or these things? That is absolutely the pharmacist's job. And they do that job better than any doctor or nurse because that is their whole body of study. Understanding the interactions of medications and chemicals from prescription to over the counter to maybe you're taking something herbal. Like I drink some type of herbal tea. They will be able to really tie all those things together. So when you have all your medications in one place, your medication pops up, The pharmacist has to review that this is okay in order to fill it. They're going to do their checks to make sure something's not interacting. And if something is interacting, that's when they may say, if it's very stark or something that can be potentially harmful, they're going to message the doctor's office, whoever sent the prescription over, to say, hey, would you like to reconsider? Or this is this. Here's an alternative. Or if you walk in with your paper prescription, they may say they you'll drop off the prescription and usually come back. And then when you have that consultation, that's a time where the pharmacist will talk to you about things that can interact. So having all of your medications in one place or is helpful. I mean, that would be that's I would say if you can at all possible, consolidate all your medications to one pharmacy. Let's see. So say all that. Yep. Pharmacists are highly trained medication experts. Use them, right? That's the free visit. Go ahead and get it. Okay. So now what can you do? You should absolutely have, if I let me just go back for a second because I did have these props here. So this one, real quick, I said go to one pharmacy. So I get all my stuff for CVS. And then like it'll have this little baggie. I mean, you guys, sorry, my little bag is kind of torn up here, but they have a little sheet. On this sheet, it gives you very valuable information. So, for example, I'm looking at it, take medication on an empty stomach 1 hour before or 2, 3 hours after a meal. These are things that are really important. Don't just take this and throw it away thinking it's just like the receipt. There's valuable information. Call your doctor if you experience mood changes, sadness, depression, or fear. Consult your doctor or pharmacist before breastfeeding. To prevent loss of effect, keep drug in original package and close after use. Protect this medication from light. There's a lot of information that comes from the pharmacy. So this little thing, many people just throw it away. They just open the bag and throw it away. But please, there's lots of information there that you can get from the pharmacy and pharmacist. Okay, now building your medication list. So you should, I know many people say, oh, my medication list is in the medical record, or my daughter has it, or so, we need you to have it. So if you could create, and you could do this, if your daughter has your list, ask your daughter to give you the list. But it's very important that you have a list of all of your medications, the medication name, the dose, how often you take it, and why you take it, and slip this in your wallet like where your identification is. So if something were ever to happen, heaven forbid, knock on some wood, but you were to go down and a bystander EMS were to come, they're actually trained to go and look at the wall. For one, they want to know who you are. And then two, that would be the best place for them to find this medication list to help them maybe understand what's going on with you if you're down and can't respond. Um, Also, keep a copy of this in your phone. Maybe, and I say that because many people carry their phone with them everywhere they go. So that's important to have this list with you at all times. Bring it in with every visit that you have. It's going to be important. And then also mention if you've started or stopped something, right? Because you might be on lisinopril. You were on lisinopril for 10 years and then it was changed and you changed medications, right? You can keep the lisinopril on there, but just put a stop date and then the start date of the replacement for it. Start and stop dates are also very important because it gives us an idea of what's been going on. Okay, so hopefully we never have to look at this because you're not able to present it. But even when you go somewhere, sometimes you go to, you're moving so fast, you get to the doctor's office and someone's asking you, well, what do you take? You're like, and then you're stuck trying to remember everything, and then you can't remember when you started, stopped. You don't know the dose. You know the name, but you forget the dose because there's been so many changes. So that's important information to have with you. So keep a copy in your wallet or purse, preferably near your ID, and then also keep a copy of this on your phone. Okay. And then when you go to your doctor's office, also make sure to run it by them. And sometimes what's helpful is if you have your list, sometimes they're talking to you about the list. They say, oh, here's my list. Sometimes they'll just take a copy of that and they literally will scan that up in the electronic health record because you know what you're taking. And sometimes something's prescribed. Let's say I prescribed Antoine to take metformin, but against medical advice, Antoine said he wasn't going to take it. At least we would. Not that he would do that, but that's also important to know because it's also presumed that everything in your medical record you are actually taking. So if there's something you are not taking, put not taking. Now, we're not going to scold you, right? We might talk to you about why that might not be a good idea for you not to take it, but we need to know that if you're really not taking it. Are you really taking it or you're not taking it? And it's okay. Just say what it is, but we have to know what you're really taking and not taking in order to manage your care properly. And so bring this to every visit. That way you can help update the list, keep it with the prescription medications, over-the-counter medications, and any other type of supplements. And speaking of supplements, there's so many. Oh, wait, I think I talked about, do I have a slide? I think I have a slide about supplements. Did I talk about supplements already? I think I did. Did I? I talked about supplements. Um,
Yes,
okay.
yes. There
But
was
there's,
a question. I'm sorry, Nurse Alice. There
oh, go
was a
ahead.
question about since you were mentioning supplements, multivitamins, and all of that, and it's kind of related to a little bit of what you're talking about now. So the first question was around how to select multivitamins or herbals to ensure they have good quality. How to do that? Is there any certification or type of container to store? And then two, should we take various multivitamins at the same time or different time to be most effective? So those are
Okay.
two questions. Yeah.
Those are some good questions. So, so first off, supplements, and like the vitamins, those are considered, dietary supplements. So they are not FDA regulated, right? So, when it comes to selecting a brand, um, I'm not the expert on which brands are which, but I would say stick with a brand that's pretty well known because so for example, and then also which one to select. Now, this is the one that I take. Now, you're gonna laugh at first. This is Nature Made. This is a multivitamin. It's a prenatal vitamin. I'm not, listen, those years are far gone for me. But the reason why I take the prenatal is because the mixture in it has additional iron. So I'm a little bit on the anemic side. So I have a multivitamin that meets my needs. But the ones that come like that are labeled prenatal, even though this is not possible for me to know more. Um, but so that's why you have to talk to your doctor or your provider about what's best for me because, and it's really tiny. I don't expect for y'all to see this, but there's a rundown of all the things that are on the back here. And so really this will depend on what's best needed for you because some people will have certain deficiencies of certain vitamins, and that's kind of how you help guide it. So like if you are someone who has like, let's say let's say I have, like this one has a lot of B vitamins because it's for the pregnant people because they're making babies. So it has a lot of extra stuff. I like this because it has those extra things in it for me. So it depends on what you need. If you're not anemic, you may not need to take this kind, obviously, unless this is what you're trying to do. You don't need that. So you would then just take a well woman vitamin. And there are actually vitamins that are kind of designed for your stage in life. There's some for the teens, there's some for um, women who are of the age, childbearing ages, and then some women who are a little bit older than that. For example, women who are a little bit older, we maybe need a little more calcium and vitamin D3 because we're more prone to bone loss and developing osteoporosis. So you want to keep those things in mind. So when it comes to how do I select the multivitamin, um, it's gonna depend on what your goals are, right? It's gonna depend on what your goals are. So again, like the one are for women who are senior, like 50, 60 and up. That's probably the one where you want to make sure that it does have a good amount of vitamin D, a good amount of calcium, because we're more prone to osteoporosis. Whereas women who are in childbearing, if they're planning to do this, there are going to be some extra things. They might need a little extra folic acid because that's good for the baby's development of their nervous system. So it's going to vary based on your stage of life. And then the best container to keep the medications in are their original containers. And then the original container is going to give you some idea. Like if you put it in a pill box, you see how this is dark brown? This means that it needs to be protected from light, right? So make sure that your pill box is just not clear. Or if it's clear, that it's inside, indoors, that you're not sitting it out at the beach in the picnic where the sun is shining on it. So that'll give you some clues as to how to best store it. And then mindful if you have little ones around, having the child-proof tops is helpful. Now, but understandably so, some people have problems opening those up, right? So the tops will be easier to open. Provided that there's no children around you that can get into it, then that still can be an option for you. And you can talk to the pharmacist about the type of lids that go on it. Those are some good questions. I like this topic. Okay. Because it feels so like usable, like something we do every day. Okay. So have your medication list. Write down any questions or concerns that you have. So like that question you just asked me, Go to when you next time go to your doctor's office, say, look, listen, I want to start a multivitamin. They're first going to ask you, well, how's your diet? Because we want to take these in the natural way as much as possible. And let's say you're doing your best, but you still have maybe some vitamin D deficiency. Well, then you might need a vitamin D supplement, but you might have some other things. So your doctor can help you to identify the best um, what you call it, the best multivitamin for you. And if the doctor says, you know what, I don't know, there's so many, the pharmacist definitely for sure is going to be that guru who's going to help you. You definitely also want to keep your symptom log, like I mentioned. Start a new medication, change in dose. Maybe you feel a little tired, more groggy, or stomach ache. Photosensitivity, it's like bright lights are bothering me now where they didn't before. Keep a log of those and make sure you talk to your doctor. And when you start or stop something, we can try to tie some of these symptoms together. And then also when you go to your visits, especially if you're on any medications for blood pressure or blood sugar, hopefully you're monitoring these at home as well. So bring a couple readings with you when you go to your visit. Generally, if someone's on blood pressure medications, and let's say you're getting ready to come up for your annual wellness appointment, I would say probably at least the month prior to maybe doing it like writing it down at least 2 to 3 times a week, so we can have like maybe 4 weeks of data. You come in and say, well, these are what my blood pressure's been running. Because many times people come to the doctor's office and the blood pressure is really high because they're nervous. And so if I can see what your blood pressures are at home in your relaxed environment, I might say, okay, well, we'll recheck your blood pressure at the end of the visit. And usually that's when you're a little more relaxed. And it's like, okay, blood pressures, okay, it's pretty okay. You were just nervous when you got here. You had a one high reading, but I can see at home your blood pressure is well managed. Now, if your blood pressure is not well managed at home, don't skew any numbers. Keep it real when you come into the office because we want to know. But bring this information to with you to the visit. This will make it a more meaningful visit. We'll be able to make more impact when it comes to assessing which medications you should still keep. Maybe we should change those type of things. Like for example, blood pressure. Let's say your blood pressure has actually been pretty good, 110, 120 systolic at home. Um, and then you come in and that first one is like 150 over 90 because you're nervous. If we just left it at that, the doctor might think, oh, blood pressure is high. So it must always be high. So bring in that data because in that situation, we may be able to come down a little bit on your blood pressure medication. Okay, same with your blood sugar readings. Bring those in too. And so any questions, these are the questions you need to ask. Don't be afraid. Okay, do not be afraid. Be empowered. And matter of fact, to say, you know what? Nurse Al said I got to ask these questions before I leave. So I just got to run through these, doc. Just hold on, okay? Give me 5 minutes. Why do I need this medication? Because we want you to understand what it is. Because some people will say, oh, well, I take it because the doctor said to take it, but just not really understand the significance of it. And that could be dangerous. Because if you don't know what it's for, you may not know what symptoms to look for. We also want to know why this particular medication is the right choice for you and right now. Um, is there anything else that I can do? Like, are there lifestyle changes? Do I need to be on this medication? Do we have to go up? We want to see what your options are here. And then when you start medications, whether it's short term or long term, okay, what effect should I see from this? Right? Okay, you're starting the blood pressure medications. We should start to see your blood pressure come down in the next week or so. Okay, so let's keep a blood pressure cap tracking and see how things are going. If your blood pressure is not going down on your readings, let's come back sooner versus later and let's talk about it. Those type of things. Or, and depending on the medication, we want to know how long will it take to be effective. That way, if it's not at goal during that time, you can get into the doctor sooner versus later because we don't want to wait a year and then it's like, oh, well, the medication really didn't do anything. And so it's like, okay, well, let's increase your dose. We don't want to wait that long, okay? No, and knowing this helps you to stay adherent to the plan. You'll want to ask about those side effects so you can anticipate them. So if they do happen, you're like, there's a side effect. The doc said that to expect that and that it would only be short term, right? So at least we have some information there. Um, Oh, I also said, wait, set some realistic. Oh, I mix these two together. How long will I take on the medication and when would it start working? Okay, but these are things you want to ask before you leave. That way, it's the game plan. So you don't want to leave with a new prescription and then not know these things because then you'll be left a little bit lost. And then questions about safety. Your doctor and your nurse practitioner is not going to know everything there is to know about all the medications and supplements. That's the pharmacist. We call the pharmacist on a regular basis, asking them for their expert opinion on medications. It's not that we don't know them. We know what conditions they treat. But when there's polypharmacy in the mix here, they know they did more chemistry than we did. Okay, so they know they're more familiar with those things about how they may interact with each other, counter each other, and they also have it's like their databases in their brain. They're so smart. You know, the XY trial study showed this, and the B trial study showed that, and they're like literally the people we want to ask about these things. But you want to ask specifically, do any about the medications on your list, do any of them counter or interact with one another? And then also with this, if there are some, you might need to space them out a little bit differently. So, for example, this one that I showed you here, actually, this is my asthma medication. I'm supposed to take this on an empty stomach. Some people, they take all their vitamins, put them in one cup, and they chug them all down at one time. Sometimes you can't do that. There's some medications that you can't mix together. Um, let's say you're someone like let's say you're taking Coumadin and your anti-acid medication at the same time. No, we can't mix those because the anti-acid medication is going to influence the ability of the how the Coumadin is absorbed in your body. So we have to think about that thing. Or if you're taking vitamin K, K2, any of the vitamin Ks, and then you're taking Coumadin, well, those may interact too. So there's a combination. So it was almost like an individualized plan for you. Literally talk to your pharmacist and say, you know what, these are my medications. This is what I take over the counter. What's the best time and spacing of these medications? No longer it is just take all your meds at 9 o'clock. And I know they do that in the hospitals. It's not necessarily the best, but that's out of because of I hate to say convenience, but there's so many patients. But for you at home, when it's in your control, you want to do the best thing for you. So, okay, some people are like, I don't like doing that. I want to take all my meds at once. Is it possible? You can, but for optimal effects of your medication and for optimal safety, you could time these out. Like magnesium. Anybody in here take magnesium? We all hear it's very important, right? Everyone, it's important for your immune system, cell growth, all these things, and everyone's like, oh, I need magnesium. There are different types of magnesiums. Some magnesiums make you poop. Some magnesiums help you to relax your muscles. Some magnesiums help you sleep. They're different types. So here is a magnesium oxide. It's going to help you poop. Here's a magnesium glycinate. This is going to relax your muscles. Make sure and this is why you got to talk to the pharmacist because you see magnesium, and I'm going to take magnesium, but if you take the magnesium glycinate because you think that I just need magnesium as a supplement, this makes you sleepy. You're not gonna don't take this in the morning, okay? You take this at nighttime in bed. But if you're just thinking, I just need magnesium because it's something that everyone's taking, I need, and it's good for me, you gotta ask because this is gonna make you sleepy. You're not gonna be attentive during the day. Okay. And you mess around and take this one, you're gonna have to go to the bathroom I mean, I don't know if that was your plan, but the magnesium oxide will make you go. So things there's timing of medications, there's a mixing of them, and there are even foods that can influence it. So I don't know who on here likes grapefruit or a lot of them like those vitamin C. Orange juice, not maybe orange juice a little bit, but grapefruit juice is notorious for influencing how medication is metabolized um, for my Coumadin people, taking it with grapefruit juice will exacerbate it and cause the medication to be more potent than it is. So you got to ask these things. There's certain dietary things that you need to know. And then again, prescription medications with your supplements. We want to keep those all factored in. So if you didn't think taking medications was going to be, it's like, oh, it's just a medication. It's just medication. There's actually a lot to it when you peel the layers back. And now, and I'm over run up on time, so I'm almost done here, but medication can also be costly. So if talk to your doctors may not know your insurance plan. Please don't be upset with us because we don't always know the what insurance plans cost us. But ask, is there a generic? If cost is a concern, ask if there's a generic. And then you can also call your insurance provider to ask them, is a generic for this particular medication to help you be able to afford it. That way you adhere to it. Um, if there's a medication, the doctor says, oh, why don't you take this 4 times daily? Like, whoa, whoa, whoa. Is there an alternative where I can take it once a day? Because then that will help you to adhere to being compliant. Now, and then is there anything that can be stopped on my medication list or decreased? These are just questions we want to ask. I'm not saying that it's wrong to take medications 4 times a day, not at all, but to make things as simple as possible for you to adhere to them to make it easier for you to take them, and then also to make this something that's affordable that you can actually afford to do. These are some questions you should ask your doctor. And then if there's a missed dose, ask what's the plan? If I missed a dose, do I double up? Do I wait the next day? How soon should I take it? Know that ahead of time before you miss the dose. If it's something that's once a day, it's probably something you could take later in the day. But if it's something you take like two, three times a day, ask the doctor what is the plan for the missed dose. Like if you missed a morning dose, um, we don't want you to, but if you do, oh, don't worry, you take it two more times the rest of the day. One time miss won't be an issue, but know what that plan is. Never double up on medication without the guidance of that. Okay, we don't want to cause any toxicity in the plan before you do it. And smart habits at home. Having your organizer, whether you keep them on the shelves together or you put them in a pill organizer. Make sure you can set alarms on your phone. That's important to remind you, especially for the new medication. We can sometimes forget. Don't wait till the weekend before a holiday to want to fill your prescriptions because sometimes you got to call the doctor. Then the doctor might say, well, you need to come in and get labs done before I can refill it. And then you're delayed. We don't want you to be out the medications at all. So request them ahead of time. If you can, if it's a medication that's chronically taken for a period of time, and I've done this, I'll order your blood pressure medications 90 days. I'll give you a 90-day supply with 3 refills. So literally, you got refills for the whole year. But now that's for people who have been established on a medication. If a medication's newer, you might not get that, right? But talk to your doctor about how we can make this refill process easy for you and let them ask, okay, for you to refill this, do I need to come in to take labs, an appointment? Let me know so you can plan accordingly so you're not on that long weekend when the doctor finally responds and says, well, you got to come in, and then you're off without medications. But I will say, if you ever find yourself out of medications, call the pharmacist and say, you know what? It's the holiday. I'm out of my blood pressure medications. I have an appointment in 10 days. Can you please give me at least a 10-day supply? And most of the times they will oblige. So don't be afraid to ask for that. Know that that is an option. And
Hey,
then,
Nurse Alice. I'm sorry, this is me again. I will be I have to run, but
oh,
you're the host
okay.
and you are good to go. Okay.
All right. Thanks, Antoine.
Thanks
Um,
everyone.
And I'm almost done, guys. So sorry, but make sure you also read the labels carefully, okay? So some medications you take on an empty stomach, some you take with food, some you have to avoid the sunlight. So those are some things that you just need to be considerate about, okay? Prevent mix-ups by keeping your medications properly separated and labeled. Don't keep loose pills on the counter, just relying on what they look like. Some medications, it can be the same medication, same dose, and they can look differently. So just be careful of that, and also try to avoid mixing multiple pills into the same pill bottle. Because that can create for some confusion as well. Sometimes you're sleepy, maybe you're not as attentive, and you have the increased chance of mixing things together. When you travel, make sure you have plenty to carry with you. Carry it in your carry-on. Um, you don't want to lose your luggage or be separated from your luggage for a prolonged period of time without your medication. And then also making sure that you have your medication list with you. That's going to be very important when you travel. You don't want to be stuck somewhere and not have your medications with you. And if you feel like you're having some side effects, especially for these skin or skin rashes, unusual swelling, persistent dizziness or confusion, or even severe constipation, these can be fairly serious side effects, especially if it's new after you started or changed a medication. Please do not hesitate. Seek medical attention right away. Rather be seen and said it's okay or it's something else versus it's really something that's brewing, could be a medical emergency, and you've waited to be seen. We want to, provide you relief as much as possible and make sure it's nothing too serious there. Um, these are some ones here where you just want you to call 911. If you're having trouble breathing, chest pain, you fainted or lost consciousness, um, or let's see, or other signs of overdose like extreme confusion, seizures, or unresponsiveness, this is the time to call 911. Not the time to just call your doctor and try to be seen today or tomorrow, but you need to go in. Okay, these can be some life-threatening situations. It could be related to your medication. Maybe it's not related to your medications, but either way, any of these things are conditions in which we would want someone to call 911, and even more so when you Hopefully you'll be able to say these things, but if or having someone with you. But if you've had a change in medications, or this will be the time to also make sure that that's mentioned because could these be a symptom of some of your medications or the medication changes? And I've talked about it already, but that annual review, make sure at your annual wellness appointment for sure. Go through your medications, go through the supplements, the over the counters. We want to talk about all these things. Let your provider know everything that you're taking, even the non-prescription stuff, because that's going to paint a better picture. We can make sure nothing's countering, nothing's interacting, and this is also a chance to evaluate. Is there some duplicates? Is there something I can decrease or might need to be increased considering any type of interaction, but this is something that's usually covered by Medicare. But then also, whenever there's a change or addition, so if you go to a doctor's office and they said, "Oh, we're going to start you on this new medication," use that also as an opportunity to do a med review at that time, just to make sure it doesn't interact. And you can say that, just so we know that this is, can you review my medications to make sure this doesn't interact with any of the ones that I'm already taking? Totally reasonable question to ask. Don't allow them to make you feel rushed. And so speak up, write it down. This is going to be very important. I'm giving you this information. These are the tools, the nuggets. I want you to feel empowered to ask these questions. And you can create a cheat sheet, and this presentation will be available to you afterwards. So if you want to go through this again, take some notes, create your list or your list of questions, absolutely please do so. But we want you to speak up. We can only care for you with the information that we're provided. We're not mind readers. And so if you're taking something that's over the counter, and we just can't understand why we're not getting up to an effective Coumadin level. The secret might be in the over the counter medication you're taking. Okay. And then if you, then we're going to manage your Coumadin dose based on what we see, not knowing about this over the counter. And then let's say you stop taking the over the counter. Then that dose of Coumadin may actually become too much for you. So that's why we got to know this information. Okay. Here's your top 5 takeaways. Keep a medication list. Make sure to mention everything you take. Ask questions at every visit. Don't allow them to rush you. And make sure at a minimum you're doing yearly reviews of your medications. And then also, if you're hospitalized, you get a new diagnosis, or you see a specialist, that's another time. Let's go through these medications because sometimes the general provider doesn't talk as well to the specialist, and the specialist, maybe it's a cardiologist. Cardiologist is looking at the cardiac meds, may not be aware about these other meds. Let's make sure everybody on your healthcare team is all on the same page with that same list of medications, and you speak up. If something doesn't feel right, even if it's you feel like, oh, it's kind of silly, it's not that serious, please say it. That could be the early warning sign. That could be the yellow flag that we need before we have to stop, pump the brakes. Tell us while it's still yellow. Tell us while it's still yellow. We don't want to wait till something's a lot more serious. And that concludes the presentation there, guys. Thanks so much. This was a really great topic. Sorry I went over, but it's just so much good information here. And I actually see patients. These are the questions I'll get asked. These are the questions I ask them, and we go over things. And so if you've enjoyed this, thank you so much for joining us. And then also want to send an invite for you to join us for our other Healthy Living with Nurse Alice series topics. Healthy Aging, Mind, Memory, and Meaning. That's in May. And then Stronger, Longer, Men's Health Essentials in the month of June.